Yeah, look, in my normal working gear, you see headset on already.
Thank you. So welcome everybody. We're now live streaming and I think it's all being recorded. So if we can just start by introductions. So I'm Margaret Parker, the chair of the board. And if I go across to where I can see people, Naomi.
Good afternoon, everybody. I'm Naomi Burke, the Engagement and Volunteer Manager over at Healthwatch Rochdale. I've recently got married, hence the Burke name. So it's nice to see everybody.
Rob.
Hi, I'm Rob Butler. I'm the Operations Coordinator over at Healthwatch Rochdale.
Kate.
Hi, I'm Kate Jones. I'm the Chief Exec at Healthwatch Rochdale.
Karen.
Hello, I'm Karen Kelland, the Chair of the Patient Advisory Group at Healthwatch Rochdale.
Stephen.
And Steve Sanderson, one of the board members at Healthwatch Rochdale, supporting Margaret in most things as well.
Thank you. Claire.
Hi, I'm Claire Birch. I'm the Information and Communications Coordinator at Healthwatch Rochdale.
David.
David Bradshaw, and I'm the Treasurer at Healthwatch Rochdale.
Ben.
Vice Chair of Healthwatch Rochdale, Ben Greenwood.
Just to recall that Melanie, who's one of our board members, is unfortunately not able to get online at the moment, but she's trying her best. But if she joins us, we'll obviously be welcome. If we can start with then the fact that the next item is questions from the public. And we have actually received 4 questions from the public. They are quite lengthy, but I will have to read them out. So can you bear with me on that? But the first question is, Primary Care Commissioning Committee of Haywood, Middleton and Rochdale CCG held its last board meeting today. Going forward, how does Rochdale Healthwatch intend to ensure that the views, aspirations and the voice of local NHS patients and their carers and families are represented and advocated for within the newly established CIS, but I presume he meant ICS, Chair Sir Lees, I think that's Richard Lees, who will be based in Manchester. Question 2 is, as you'll be aware, from the 1st of July 2022, the NHS in England will be reorganised. England will be divided into 42 new local NHS bodies called Integrated Care Systems. How does Rochdale Healthwatch expect current levels of engagement with those tasked with the commissioning NHS services in the Haywood, Middleton, Rochdale area to change? That is, to be reduced, be maintained at the previous level, or be reduced significantly, ? Bear with me. Question number 3. Healthwatch England reported in January 2022 that the Accessible Information Standards is mandatory for all organisations that provide National Health Service or adult social care. Here's some key information about the accessible communication you should expect from services. So, if you're speaking to a dentist, doctor, care home manager, or any other provider of health and social care, here's what you can expect. You should be able to contact and be contacted services in an accessible way, for example, via email or text message. Information and correspondence should be given in formats you can read and understand, for example, in audio, braille, easy read or large print. You should be supported by a communication professional at appointments if this is needed to support conversations, for example, through a British Sign Language interpreter. Health and care staff and organisations to support you to communicate, for example, to lip read or use a hearing aid. So could I ask the Rochdale Healthwatch Board if they are aware of any local audit that has been undertaken recently, that is in the last 5 years, to check that all organisations that provide National Health Service or adult social care locally actually abide by this mandatory accessible information standard? I'm going to take a drink now, you bear with me. So question number 4, as part of the Your Care, Your Way campaign, Healthwatch England set out 5 headline recommendations to help health and care services ensure that people who have communication needs are given their healthcare information in the way that they need it. Health Watch England recommended in February 2022 that by law, all public funded health and social care providers must fully comply with the Accessible Information Standards, IAS. The standard requires services to meet information and communication needs of people who have a learning disability, a sensory impairment or loss. There's growing evidence suggesting this is not happening. Every health and care service should appoint an accessible information champion to receive additional training and identify local challenges, barriers, and best practices. These champions should report on how services deliver the standard back to ICS board level. Question is, does Health Watch Rochdale know who the accessible information champion for Greater Manchester, again, it's CIS, but I think it's ICS it means as is, and when they will be appointed in post? So if I could formally hand these over to you, Kate, for you to respond. For information, the first two questions came in just over a week ago, but the second two questions only came in yesterday. So there is a different timeline in terms of responses, I think. But I'll hand it to you, Kate.
Margaret. So the first question relating to the Primary Care Commissioning Committee, I've had a conversation with Sarah Crossley, who's currently the head of Primary Care Commissioning for HMR-CCG. So the Primary Care Commissioning Committee will change and it won't run as it currently does. There will be a GM Primary Care Commissioning Committee, which will cover the whole 10 of the boroughs. And then there will be a subcommittee at a local level, which Health Watch Rochdale will be sat on. So the arrangements are to be confirmed yet how Health Watch Rochdale will continue to represent this meeting locally. In regards to how our views and information is passed through, we've got various mechanisms in place and that we're developing, and the rest of the agenda and the update that I'm going to provide will give more information on that. So number 2, in regards to the changes to how things are going to be done locally. So just to let you know that the current HMR-CCG staff are remaining in post. They're just moving over to a new organisation. So we will continue to engage and hold relationships with the existing staff that we engage with now. There will be new ways of working from the NHS perspective, but that should show no impact in regards to public engagement and what's required under the NHS statute. Question 3, in regards to the accessibility information standards. So just to make you aware that Health Watch Rochdale have done some work around this, and we have completed audits within the last 14 months. We did audits on all the GP websites, and accessibility standards was something that was reviewed as part of this. So issues that have been raised, we're picking up with the GPs individually, and we held a focus group on that last night to try and improve on the websites as a whole. In regards to the finer detail about the whole of the health and social care services across Rochdale, unfortunately, capacity is always going to be an issue for us to be able to put, implement and check upon something like this. And the fact that our work is more reactive than planned. So the fact that information coming through to us is what makes us highlight pieces of work from the information that we're getting on the ground. And then finally, just to add on to that, something that I will take away from that and I will need to gather further information on is there's an element around the accessibility standard information and the commissioner's requirements to have this as part of the contract monitoring. And I'm sure that will be in place, but I will just go away and check. And then finally, question 4, as Margaret said, these only came in yesterday. And unfortunately, I don't have a formal response to this at the moment. However, I will go away and all formal responses will be written on the website. And like I said, further agenda items today should clarify more information in regards to those questions.
Thanks very much, Kate. Appreciate that. So if we can move on then to the next item with the presentation, which I gather you're doing for us, Kate, today on Health Watch Rochdale and Health Watch in GM in Greater Manchester update on the ICS and local health and social care arena in Rochdale. So hopefully this will help with the questions, as you say.
Just bear with me 1 minute. So today I'm going to be giving you an update in regards to the Health Watch in Greater Manchester and the future integrated care system and reflecting on that and what that's going to look like locally in Rochdale. To start off the presentation, I am going to play a video, and it is a 5-minute video. But this video is by the King's Fund, and it really breaks down the changes that are happening within the NHS locally and at a Greater Manchester level. So hopefully with one click, This should work. No pressure. Are we good? Can everyone hear that?
Big changes are taking place across the health and care system. What does this mean for the organisations that make up the NHS? How will they collaborate with other parts of the system? And what will these changes mean for you and me?
Yeah, should
When
the
the
video
NHS
be showing, or should it,
focused
or
on
just
treating
sound?
single conditions or illnesses. Since then, our health...
Sorry, can you not see this video?
No.
Right, bear with me.
We're just hearing the video, not seeing.
Rob, is there anything you can do to bring the video up and share it away from the presentation?
Let me just have a quick look.
Sorry about that, I assumed you could see it. We did practice this and it was working, so I don't know why it's not now.
Always the way, isn't it?
Yeah.
Rob, have you been changing things again?
Oh, I have indeed, of course. Best laid plans. Bear with me just 1 second. Right, so if I can share my screen with you, bear with me.
Oh.
Right, just let me know in a second if you can hear it when I press play.
No. So if you go into this,
Yeah.
across the health and care system. What does this mean for the organisations that make up the NHS?
Now it's very
How will they
quiet. We need to
collaborate with other parts
undo.
of the system? And what will these changes mean for you and me? When the NHS was set up, it focused on treating single conditions or illnesses. Since
Rob, if you go onto your share,
are living longer, and many have multiple
Very.
conditions that require regular, ongoing care. However, this hasn't been reflected in the NHS's structure, a patchwork of organisations that often work independently from one another. Navigating this can be confusing and can have a negative impact on our experience of care. So, for some years now, health and care staff and leaders have been working to bring organisations closer together to better meet our needs by working in a joined-up way. Primary and secondary care, social care, mental health and community health services have been seeking to partner with each other in different ways. At a very local level, GP surgeries have been coming together to form primary care networks, groups of practices working together across areas called neighbourhoods. By sharing resources and working closely together with other local people and services, they can provide a wider range of services than a single GP surgery. Health and care organisations have also been working together across larger areas called places, often covering the same area as a local authority, where large parts of the NHS budget are spent. Here, local government, charities, residents and NHS partners can work together to understand and meet local health needs. But previous laws have prevented services becoming even more joined up. The 2022 Health and Care Act aims to change this and make it easier for organisations to work together. But what do these changes look like? Organisations are now coming together across even larger areas to form integrated care systems, partnerships of health and care organisations that plan and pay for health and care services. There are around 40 integrated care systems across England, and although they've existed for some time, the Health and Care Act gives them legal status, as well as new powers and responsibilities. Integrated care systems are made up of two parts: integrated care boards and integrated care partnerships. Integrated care boards decide how the NHS budget for their area is spent and develop a plan to improve people's health, deliver higher quality care and better value for money. Integrated care partnerships bring the NHS together with other key partners, like local authorities, to develop a strategy to enable the integrated care system to improve health and well-being in its area. NHS trusts are also coming together to form provider collaboratives, new partnerships that can bring together providers such as hospitals, mental health services, and community services. So how are these new structures funded? Integrated care systems get most of their money from NHS England, which is the national body for the NHS in England, and sets the operational priorities for the health system. It's responsible for the health services you and I access day to day, which are inspected and regulated by the Independent Care Quality Commission. The Department of Health and Social Care sets out what the NHS is expected to deliver for the money it gets from the government, which comes from our taxes. It also holds budgets for some of the other areas that have an impact on our well-being, like public health. Throughout these new structures, local authorities play a key role. They receive money locally and from national government, which goes towards funding a range of services that support our well-being and prevent ill health. So, what does this all mean in practice? The Health and Care Act has put in place a legal framework that enables services to work more closely together, so it's easier for you and I to receive the care we need when and where we need it. For these changes to succeed, staff and local leaders will have to work with one another differently, alongside key partners in local government, the voluntary sector, and communities themselves. Of course, services face other challenges like workforce shortages, growing waiting lists, and the impact of the COVID-19 pandemic. While the new structures won't fix all these issues, by enabling services to work more closely together and join up services for patients, it's hoped that the health and care system will be better able to meet our changing health and care needs in the future. Find out more about how the health and care system is changing at www.kingsfund.org.uk/explain.
Thanks, Rob. If you could stop there, and now I'll bring my presentation back up. So hopefully that video gave you an overview in regards to what is changing within the system, and thinking about the mentioning of the CQC there. So just to throw out there that we are at a national level a subcommittee to the CQC. So our national our local information is fed up nationally, so our information does get fed into the CQC. So that was the video that I wanted to show you. Just bear with me. So I'm going to move on to looking at the Health Watch work in the Greater Manchester network. So recently there's been an all-age strategy that's been created at the Greater Manchester level. So who we are, so the Greater Manchester is a partnership between 10 independent Health Watch organisations, each set up in different ways with different constitutions, but with overarching aims, objectives and statutory duties at their foundation. And they are Health Watch in Bolton, Bury, Manchester, Oldham, Rochdale, Salford, Stockport, Tameside, Trafford, Wigan and Leigh. So what is the vision of the Greater Manchester network? We want a world where we can all get the health and care support we need. And what is our mission? To passionately illuminate the voice of our diverse communities in Greater Manchester and to advocate on their behalf at all levels of new integrated care system. So I'm not going to read the full strategy out, it's there on the page and this information will be put on the website. Sorry, it currently is on our website, the Greater Manchester Strategy for sharing. What else are we doing at GM? So we've got a collaboration document in place, which really sets out how we're going to move forward with working under the ICS structure. So at the GM at the moment, we're in talks as a partnership, with the partnership at that ICS level, that integrated care level, at the GM level to see how we're going to manage the new setup moving forward. So there's various meetings that have now been created and that have been ongoing in shadow format for a while at the Greater Manchester level. And some of those that we're engaged with as a 10 GM are the Comms and Engagement Greater Manchester meeting, the Greater Manchester meeting for Engagement and Assurance, which is a management group. We attend the Quality Committee at Greater Manchester level. We attend the Population Health Programme Board and the ICB Experience Group. So there's various more meetings that are developing, and the primary care will be, which I've already mentioned as part of the board questions, will be another one. At the moment, no representatives from Rochdale attend any of the GM meetings. They are picked up by other chief officers and chairs within the Greater Manchester network. However, that doesn't mean that myself or Margaret won't be on any moving forward. So the collaboration itself and how we're looking at working together, recruitment is key, and we've put a partnership bid together to look at how the work that we want to achieve with our strategy and with the development of the ICS, it can be done. So what we are looking at is a GM network chair and vice chair, which will support the role at the GM function. We're also looking at an associate CEO, which will sit above the in line with the other chief officers, but correlate and connect a lot of the work across the 10 boroughs and the independent health watches, and then admin support to do that as well. So in regards to the work that's going in Greater Manchester, Health Watch England are in the background and are supporting and advising on the work as we push forward with that. We are doing one particular planned piece of work as a GM, and that project is a repository project. And the repository project is looking at how our information and data is going to be shared so that we can ensure that the Greater Manchester Partnership and Integrated Care System can receive our collective information. So this is the first step into seeing how we can work better together, as 10 small micro-organisations, and use best practice and push things forward there. But just a quote here from our GM strategy just saying, Healthwatch obtains the views of local people about their needs and experiences of care and makes those views known to leaders who commission and provide and scrutinise services in localities. So Healthwatch, this bit more about the Healthwatch Greater Manchester. So Healthwatch is a champion for people using health and social care services, and we can support the work of the ICS in a number of ways. So we can represent, so we're a trusted voice for people and concerns and can ensure that patients' voice are heard. Because of this, we can help you make decisions informed by the views and experience of those who use services. So as a 10 GM, we can look at involve and engage. So we are present in the heart of all our communities. Our network volunteers and links with the voluntary and community sector means that we can help you engage with those voices and seldom heard groups. And we work together to design services using experiences so that they do work for everyone. So provide data and insights. This is a bit around that repository key piece of work, and Claire's working on that from a Rochdale perspective. So making the right decisions requires access to the best possible information. So we can work with you through a partnership agreement to ask the right questions, collect high quality data and present the findings in a way which forms future planning and confidence. And then finally, the information sharing. So sharing information, we can hold the information following up from the ICB and down to the individuals and groups throughout the ICS. This includes the most hard to reach communities, sharing their concerns with you and informing them of the ICS plans and developments. So we can really be that person that's on the ground delivering that local information. We'll partnership with Healthwatch. So as a GM, we propose creating a partnership agreement between the ICS and the 10 operating health watches that sit within the Greater Manchester area. And whilst Healthwatch statutory functions are commissioned by the local authority for place-based activity, many Healthwatch operate on small budgets, which make additional ICS activities a challenge for us. So there will be some capacity issues as we move into this new footprint as a Healthwatch, and that's something that we can't ignore. So what do we suggest as a 10 Healthwatch? Well, a partnership agreement is signed and shared around shared priorities and responsibilities, which recognise the value of Healthwatch and the importance of our continued independence. And I think the key word there is the independence that we hold. We will delegate authority to the chair and vice chair of the network, who can join the Integrated Care Partnership board and partnership meeting as a non-voting member and work with the Healthwatch Associate Chief Officers and provide coordination for the partnership. Now, just to confirm, this is what we're hoping for. This isn't in place yet, so we are working towards this. So resourcing of the Healthwatch, we need to look at how we're going to put that in place and where the funding is going to come from that. And then agreement and put in place for Healthwatch for bespoke research and engagement projects as agreed. There is an expectation at the ICB level, at the Greater Manchester level, for Healthwatch to be able to do engagement on behalf of the system. What we need to make sure that engagement is effective and that we're involved in the planning from the beginning and that it's working for our population. So that's something that we will work on as the Healthwatch in Greater Manchester. And then just quite a powerful quote, well, a factual quote really from our chair over at Healthwatch England. So Robert Francis, he says the Health and Care Bill sets out a clear expectation that Healthwatch, as the statutory champion for service users and the public, will play a key role in supporting both the integrated care boards and the integrated care partnerships in delivering their statutory duties to engage in communities. So that's a bit of an update in regards to what's going on at that DM level. So where does Rochdale fit into this picture? So locally, over the last 18 months, we've been really working on our decision-making policy and developing our advisory group and looking at how we're managing that data. And if you can see on this document here, the decision-making process, this shows how operational staff team go out and gather the feedback, how it comes into the advisory group to be reviewed and analysed, and how information then comes up to the board. And then it's the egg timer that turns on its head and the operational work goes back out and is done. A key thing that we need to look at is how we're engaging, both with residents to gather that feedback and partners and service users. And there's various mechanisms that we've got for that, our advisory group, our website, our secondary care opinion data that we receive. We've got face-to-face and virtual platforms engagement. We've got our information, advice and signpost surgeries now that we have up and about in the borough. So we are constantly gathering that soft intelligence, that patient experience, patient journeys of what the services are receiving. So the key thing, and this is something that myself and Karen Kelland are really keen to push forward with, is the data sharing. So as a Healthwatch, I've alluded to the fact that we receive so much information, and at the moment we're reviewing that as an organisation, but we're firefighting to try and get that into the system to see how we can hold the system to account with what we're being told. And that's something that we are working from, and me and Karen had a really positive meeting this week. So although not direct with the LCO, the local care organisation, and the new local structure, which we're trying to get involved in, this was a different meeting, and we went with the providers directly. So Karen and I had a meeting with Northern Care Alliance, head of PALS and complaints, the director over there, and the equivalent for Pennine Care. And we're looking at avenues and ways in to share our feedback that we receive, and then to see how it's going to be utilised in regards to quality improvements. So it's a very beginning of a start of a piece of work. The meeting only took place this week, but it's exactly the route that we want to be going down. We want to be telling the service providers what people are saying about their services, and then we want to see from any negative that's coming off the back of that, how the services are going to look at improving the delivery via the quality improvement pathways using that patient feedback. So also from a local perspective, impact and outcomes is something that's really key on our agenda, and has been for the last 12 months and will continue to as we move forward this year. So we have implemented the Healthwatch England quality framework, and we're working to that. And that just means that there's a consistency in our work and in our approach, and there's high standards in what we have to deliver on. And then we have our impact tracker, and that's really to measure the impact and outcomes of the work that we're doing. So the small wins and anyone that we're helping are just as good as the big wins, but we really need to start looking at how our data is making that impact and where we feed that in. So looking at local meetings and what we currently attend this year. Now, this is just a snippet of more of the strategic meetings. There's about another 50 meetings which we are asked to attend on a monthly basis. So again, thinking about that capacity and how we move forward. So we've got the Integrated Commissioning Board, the Northern Care Alliance and Joint Healthwatch Partnership Board, which is a corporate level, not at local level. So that covers the 4 sites, and our other Healthwatch colleagues in our neighbouring boroughs come to and attend that. Same with the Pennine Care. Primary Care Commissioning Committee, which obviously that stands down from, that's now stood down as of Friday. The Rochdale Borough Safeguarding Adults Board, the Rochdale Borough Children's Partnership, and then we do attend the joint safeguarding meetings as well. We've got the GM, Chief Officer and Chairs meeting, which is all to do with our network at Greater Manchester level and the Healthwatch work that's going on there. We attend the Quality and Safety meeting, Health Overview and Scrutiny, and the Health and Wellbeing Board. So I just really wanted to highlight those key meetings. So what's next for us and where do we fit in locally? So this is one of the many diagrams that you might have seen from information that's floating around in the borough and on the council websites, and it identifies one of the key frameworks for the future strategic meetings within the borough. So as you can see, the green ticked meetings are meetings that have been confirmed that Healthwatch will attend, and we're just waiting for further information on them. Health and Wellbeing is a statutory requirement of us as part of the Care Act, and that's written in to say that that's a meeting that we have to attend. The engagement one, not too sure what that meeting's about at the moment. I think it's going to take a broader horizon in regards to some of the engagement work during COVID, and looking at what we're doing as a Rochdale health and social care arena about how we engage, and bringing the voluntary sector heavily into that. The quality and safety meeting will take over an existing meeting, and all that's changing there is the mechanisms in regards to those reporting up to a Greater Manchester level. So that's something that we have attended and will continue to attend. And then we've got the clinical professional forum. So I attended the last previous meeting to this, if you know what I mean. It's changed over slightly, and the terms of reference were reviewed at this meeting. And there was I did raise concerns in regards to our role within those terms of reference. So we're just going back and making sure that our our scrutiny role is key in any of the terms of references that are coming through. We keep getting referred to as support for engagement, and it's about identifying the fact that we have a statutory function at these meetings, and that is to scrutinise, to challenge, and to be that critical friend, to ensure that the voice of the borough and the people is coming through. So one of the questions that I have had with local leaders is around where we sit on the other side of the framework, and we are hoping that that will be with the local care organisation. So that'll be a meeting that we will be invited to and hold the system to account. At the local care organisation, it's a mixture of local commissioners, which sit within the GM, which will sit within the GM footprint, as well as local service providers. And it's a good opportunity and a good space to really inform what we're being told on the ground, and look at how our data can improve services, and building then that quality improvement work that we're doing. What's next? So local scrutiny role, which I've mentioned. So that's something that we really need to push for, and myself and Margaret, are back out at face-to-face and virtual meetings, really, putting ourselves out there to say this is what we're here for, with that critical friend. But we need to work out with the system how we do that to the best for everyone. Thinking about our capacity as an operational team, and thinking about the number of meetings that we get invited to. So some of the problem is, we are invited to the strategic meetings, but we're also invited to the planning and the operational stuff as well. And it's just not something that we can manage. So future meetings arrangements in Rochdale, as I said, I'll give you a brief overview there of one little snippet of that future governance arrangement. There's so many meetings missing off there, like the safeguarding boards and things like that. At the moment, we're not 100% sure where we're going to sit within that system. However, I've got reassurance and I've got trust with the key leaders that I'm working with locally to ensure that we are around the table to get that voice heard. So local data sharing and the triangulation of data is really key. And that's something that, with the advisory group, we're going to continue to push locally with the local care organisation, as well as working separately with providers. Sorry, I just need to move you guys over, I can't see. So Health and Greater Manchester Development, that's going to be a massive key work programme for myself and Margaret over the next 12 to 24 months. It's not going to be going anywhere. There's a lot of work that we need to be looking at in the Greater Manchester Health Watch footprint around best practice, and not just looking at the health and the economy side of things, but looking at how we can streamline, how we can standardise, and how we can save money in the long run as 10 micro-organisations. And then finally, I've already mentioned, but the impact and outcomes is massive for us moving forward. We want to really be pushing the you said we did, identifying what we're doing with your data and your information, and showing that the impacts that can be made through people sharing their experiences with us. So I'll wrap up there. Any questions? Thank you very much.
Thank you very much indeed, Kate. I mean, that's a whistle-stop tour here, because you can imagine some of the complexities that's going on at the moment, and the work that's going on behind the scenes. We're still at the very early stages, and things are a lot more to be sorted out as we're going forward. But any questions from anybody else on the board at the moment? It's a lot to take in, I'm afraid.
Karen's got a hand up.
Yeah, well, Karen, I didn't see you.
It's okay. I was just looking at the information there. There's a lot to take in.
Yeah.
And I was wondering about Kate, when you showed the work of the Health Watch at Greater Manchester level, and the mission there, I can't quote it directly, but in all the narrative, I just felt that we were lacking the QI aspect of it, and our importance, because for us here in Rochdale, key is our profile within QI, and that we want to be a respected factor in those QI processes, right through the strategic side, through into the providers, which we're already working on.
Yeah.
So I was a little bit. I did expect to see more of that, and co-production being measured, because for me, Healthwatch is key to promoting that co-production voice that we have as residents wanting to help improve services and to be an important part of designing services as well. So if that's Greater Manchester and that's our leadership, I really would have expected to see more of that in that narrative.
So just to come in there, Karen, so Greater Manchester is not the leadership. That's not the case. So we are still
we're equal members in that group.
Yeah, absolutely. So I think the strategy itself, I mean, if you look at the local Healthwatch Rochdale strategy, it really is it's not that fine a detail around the QI element that we're really pushing for in Rochdale. And what we have to bear in mind is we are all 10 independent organisations. So because QI is high up on our agenda, and I'm not saying it shouldn't be on everyone's, Karen, but because we are pushing and really wanting to embed that within the Rochdale setting, that's something that I can share under best practice and the developments that we're doing locally, but it's not something that I can push at that GM level. I can ask for it and advise people to really, speak to the local service providers and see how that can be improved. All I can do is take that back to the GM and share your comments around the quality improvement side of stuff. This is so new and things aren't finalised. There'll be another 20 meetings at a GM level that are going to come out the woodwork yet. We do sit on the quality and safeguarding GM meeting, and we can feed into that. So I think for me, it's looking at what our processes are locally to ensure that the QI information that we're working on, the quality improvements, is fed up into that GM stream, so that then the GM system are aware of what's going on in Rochdale, and then that's a request that maybe they might have to mirror that locally. For that, around that feedback. So I completely take your comments on board. And again, around the co-production, what's difficult is as a statutory organisation, our role is not to co-produce. That's not part of our statutory functions, and that's what we really had to focus on at the GM level. So that's why that certain things aren't identified specifically. Now, just on the strategy, I mean, obviously Healthwatch Rochdale have our own strategy, and that is due to be refreshed this year. So I think this is a key time in regards to what we're working on locally. And I don't want the GM work to ever distract from what we do locally, because it never will. We're just feeding into the system. And all we need to do is ensure that we've got those mechanisms to feed in at the GM level and hold to account. Whereas locally, we will continue to really push and look at that quality improvement and that co-production and ensure that, we're around the table and the voice of the public is as well, Karen.
Yeah, because obviously as Rochdale residents, we use services across the GM footprint.
Yeah. So
that voice needs to be present across GM. Yeah. So yes, I agree with you. We are all working differently, but fundamentally we all want the same thing as patients who come forward, to try and help improve health and social care services. So that is what should be the fundamentals of GM's Healthwatch aims. I know that you say we're not part, but co-production is an approach. It's an approach, and co-design will happen in the different organisations, and hopefully it would happen at ICS and our LCO. But unless we have that voice and we're being supported in that voice, and we're all speaking from the same hymn sheet, so to speak, we're going to be fragmented, and we don't want to be. We want to have that same loud voice.
I think at the end, where we are, Karen, is a major step forward from where I know that it was before I joined as a chair. And I know that some of the experience that's happened before, and I'm sure that I think you've been participating in earlier meetings, that I think it's where we're at now in terms of getting everybody to sign up. And I think we've got to push more, as you rightly say, as we're going forward. But it's a major step forward. It's a major development, and it is getting us to work much more cooperatively together and be one voice as we're going forward, which is a real strength, I think, as we're going into working with the ICS. And certainly we've got a draft partnership agreement that we want to establish with the ICS, which maybe we can bring in more of that element and that voice, as you say, to be actually be clearer as we're going forward. I think it's just that some of the other health watches are just not ready in some respects to go and do that broader debate as you're asking for, but we're getting there, and we've certainly made massive improvements, I think, over the last 6 months.
I appreciate that. I understand what you're saying, but I just think our representation,
we should lose sight of it. Yeah,
exactly, because fundamentally that's what we're about, and it just feels as if it's all being diluted again. Do you know what I mean?
Absolutely. Yeah,
because I understand passionately illuminate, but again, that's not collaborating with organisations, and that's what we want to do. I think that's the language and the narrative I expected to see.
Yeah, I mean, we've also got it in place that we're going to review it annually, and so there can be refinements as we're going through that actually enable us to bring that element through much stronger as we're going forward.
Yeah. Okay. Thank you.
And I noticed there's some exchanges between Stephen and Rob about the GDPR stuff. Is that right? Do you want to, is that answered now, Stephen? Are you comfortable?
Yeah, yeah. So long as we have something in our GDPR process that says if we are going to share it with other people, but that needs to be something probably a bit later on when we look at processes.
Yeah, so that's already in place. Just to confirm, that's the work that's being picked up under the repository work.
Yeah,
we already have a data sharing agreement in place as a 10GM anyway, and if there's any project work that's completed, we have a separate document that we can share with service providers and commissioners to ensure that the data is shared. Just to confirm, all our data is anonymised, so no personal identifiable information is ever shared.
That's all right. Yeah,
no problem. Thank you.
It was just a concern. You know what I'm like with GDPR.
No, that's absolutely fine, Stephen. But Claire's our voice on that group, and certainly they feedback and do regular reporting back on the project in its very early stages. But there's lots of good work going on there, and we have great hopes for that being a way forward in terms of influence of the ICS as we're going into the next stage.
Margaret, Ben's got his hand up.
Sorry, Ben, I'm not seeing it on here. I'm sorry about this, Ben. Right, thank you.
Thank you, Chair. Really informative presentation, Kate. Thanks for doing it. Just a sort of final point. Obviously, today is the last day of the Haven, Middleton and Rochdale CCG. So I wondered if we could possibly just say something on Twitter or whatever, saying thank you for work. A lot of people from the CCG will be working in the new system, the new structures. But we should say something, over the years we've had a good working relationship, and we look forward to working with others, etc. I'm sure Claire can come up with a form of words that are a bit better than that, but I think it should be that we should mark the occasion, so to speak.
Ben, I think that's a very good idea. If we can take that forward, Claire, that'd be great.
Yeah, absolutely. I was just about to tweet on Twitter that Ben was asking a question, and then that was the question, so left that hanging.
Right. For some reason, it's not showing everybody. I don't quite know why, but anyway, I'll get that sorted out. It's the first time I'm using this laptop, but thank you. So if everyone's okay, we'll move on to the next agenda item. Is everyone fine with that now? Thank you. So if we go to the actual core of the meeting, of that minutes of the meeting, is everybody okay with the minutes of the meeting and willing to approve them?
Yes.
Yep. Thank you. Action log. I'm going to rush through this one. I didn't see anything. I wouldn't suggest we put it on screen, Rob, because I didn't see any outstanding actions from any previous meetings that we need to check at the moment. Is that right?
I'm just going to quickly double check. Bear with me.
Yeah, that's right.
I went through it earlier on and I didn't see anything.
No, that's
yeah,
fine.
all outstanding action. Everything's been actioned on there.
Right. And were there any matters arising from the minutes anybody wanted to raise at all? Right, thank you. So if we could just confirm if there's any declarations of interest that need to be registered?
Nope.
No. I'm getting nothing. I've just noticed that Mel's here. Sorry, Mel. Welcome. I'm glad you're able to join us in the end. I know how difficult it is.
Margaret, can I just apologise? I don't know why my camera's not on. I think there's a problem with my laptop. It's saying it's on, but it's not. So apologies for that.
It's a bit like me and my screen. I can't work it out. I'm doing wrong here. Anyway, that's IT for you, isn't it? All right. So if we go to the next item, key item, advisory group reports. So we can hand that over to Karen, please.
Thank you. Thanks, everyone. We've simplified our report. I hope members of the board recognise that. So it may look like a shortened version, but we were hoping to make sure that we were focused on the reports. I think a comment that you as Chair, Margaret, made was that there was a lot of information there, but we just needed to pick out what the essential points were really to bring to board.
I welcome it. Thank you very much indeed, Karen. I appreciate that.
Oh, good. Thank you. And I'll be asking for everybody's feedback at the end. So this is our report, our intelligence update for the period 22nd of March to the 30th of June. We have looked at our updates on the work plan priorities. We've been working with the previous years, and I understand that the work plan for the coming year is in process of being designed. Work stream 1, GP access, and looking at GP website standardisation. There has been slow progress on that. As usual, we're working with other organisations. We're working with the CCG, and PPGs are still not yet fully reinstated, and some of the work by the CCG was looking at, just noticed there it's all sideways on the screen, the report. The COVID pandemic has put a big hole in the PPGs that were operating. I think there were around 11 that were attending the locality PPG group, and there were varying degrees of commitment, if you like, from each of those. So we're still waiting for the feedback there from Phil Burton from the CCG, but I appreciate that that's the last day today for the Rochdale CCG, so I don't know what's going to happen from that, but we haven't heard back. And a public focus group has been arranged by Health Watch Rochdale to look at the GP websites. Workstream 2, enter and view. As you know, that's not been reinstated, but we've had discussions about which of the best areas for us to actually be looking at, considering patient feedback and the wider picture that's happening in our health and social care services. And I know, Kate, you have met to look at the Observe and Act activities that go on in the hospitals at Rochdale, in the hospital at Rochdale, and we'll be participating in that as part of our enter and view function. Workstream 4, the information, advice and signposting services. The group has been looking at how we can best look at the information that we receive, the feedback, and we've been looking at the raw data so that we can better understand, rather than looking at it in numbers and percentages. We're actually looking at the raw data where we feel we need to, which is giving us a better picture of that feedback. And we're looking at what's the best way, because obviously it's a lot of information for advisory group members before meetings. The raw data's shared along with a lot of other information, and some members felt it was a lot. So we're just looking at the best ways to look at that information and identify those trends. One of the concerns we discussed was, as we are a signposting organisation, how do we measure that it's meeting the needs of people who come to share that information with us. We obviously don't know what happens to those people once they've raised those issues and then been signposted on, and we wonder if that's impacting on our, the evidence base for us as a group and for Healthwatch Rochdale generally in what we are achieving, the impact that we are having. Workstream 4 and 9, the about volunteers and the advisory group. We had concerns that some of the terms of reference and the role and responsibilities of members of the group were very comprehensive, and we were concerned that they might be putting potential members and volunteers off. So we've been reviewing that and simplifying it to see if we can support our volunteers better. So red flag issues that we've identified, we'd like to bring to the board. Number one, our external collaborative working relationships. We've alluded to that in the very good presentation from Kate. And we have been concerned. We know that we've had COVID, but it was a concern pre-COVID, how we work with the other organisations in health and social care, and how we can develop those meaningful working relationships so that we don't just end up a silo of data here at Healthwatch Rochdale, that information is going to be actioned and it is going to contribute to the improvement of quality. I've mentioned before, we had a talk at one of the previous board meetings from Sandra Crosdale, and we made contact with Sandra after the meeting, after she gave us an overview of how it's going to work in Rochdale. And we did say we needed to follow up on that. I'm hoping that we'll still be able to do that because we haven't done it so far with one thing and another. But it's important because some of her comments did imply that we hadn't had patient input to date, really, in that strategic sense. And so that patient voice strategically is a concern, and it's something that we do need to pursue. Number two, with no clear offer from the advisory group for local health and social care organisations. As I've mentioned just before in my question, the overall aim is that we are a respected factor in quality improvement of services. And as I've just said again, we have a lot of information that we want to share, both positive and negative, that can help to improve services. And our overall voice, I think, is that we want to help improve services. And we need to be very clear. We're going to, I think, have an away day so that we can be very clear about what our message is. I noticed in the board report, the report from Healthwatch Rochdale, we mentioned the advisory group, but as in looking at measuring the impact that the advisory group has had, I don't feel that we're able to evidence that properly and show that. Internal staff structure, I mentioned this because we've discussed before about how a lot of the actions that come from our meetings seem to fall on Kate. And we obviously we've just mentioned, haven't we, that it can be, because of capacity, it can be an issue on how we can effectively work with organisations. So that's an ongoing issue for us. The public concerns seem to follow the same sort of trends. Access to services, problems with the GP access following COVID, accessing face-to-face appointments, the length of time having to wait for appointments. The attitude of receptionists is appearing. A slow referral to secondary care, which some of these are national issues, a lot of them are national issues, and pain management coordination between the GP and the pain management service. Number two, medication. There seems to be feedback coming from the fact that it's a national directive that changes are being made to prescription of certain medications. Unfortunately, these changes seem to be being made without any awareness from the patient, communication with the patient, so they're having, you know, a surprise when their prescriptions aren't being fulfilled the way that they've asked for, and they're having changes made. And as usual, there's the problematic repeat prescriptions that seems to keep popping up. Poor communication. The moving on service users are still telling us that they aren't clear about what the new service will offer, how it will look, when it will be reinstated. And the Greater Manchester celiac service is uncoordinated, according to one of our feedback that we've received. I've gone on. I've gone on to the next one. Sorry, I'll go back to poor communication. Misunderstanding has caused one of the patients from an orthodontist to be deregistered. So moving on to unmet need, and this is a national issue. Hospital follow-up on discharge has been slow. That is a concern, considering that the change has been made to discharge to assess model, where patients are being discharged for their ongoing needs once they are discharged, rather than whilst they're inpatients. People have reported poor antenatal support, bereavement support after stillbirth. Mental health is featuring again where they don't feel supported, and family not being supported. And as I just mentioned there, the celiac service is uncoordinated. So we wanted to ask the board what information and key issues from the advisory group would be most useful to you to know, so that we can refine this report, the intelligence report that we bring to you. How can the board support the CE role, which in turn will support the work of the advisory group in terms of actioning the feedback that we receive, and how does the advisory group and the board measure our outcomes and impact as a group? So I'll hand that over to you.
Thanks very much indeed, Karen. That's really helpful. I'm tempted to come in straight away, but I think I should hand it over to the board and see if anyone else has any comments before I come in with my usual observations. Any observations, questions, comments?
Sorry, Margaret, it's Kate. Can I come in just in regards to some of the questions that Karen asked in regards to her update?
Yeah.
Because I think there were some question marks in regards to what's next. So Karen touched upon the Enter and View as part of the work programme. So just to reiterate there, we have been in contact with Alison Kelly, who's over at the lead nurse over at the Northern Care Alliance for Rochdale, and we are going to be going and getting our Enter and View volunteers trained up to do the Observe and Act for us to be ready to go in and do Enter and Views come December. And the area of that is going to be the hospital setting. So we're up at the Rochdale Infirmary on a monthly basis gathering feedback, and it'll be the review of that information which will identify any specific service areas that we decide to enter and view. So just to give you that update there. Karen asked in regards to how do we know in regards to the signposting that we're doing, whether the services that we're signposting to are effective. So we do have a follow-up process and evaluation, and that's something that Rob deals with through the information inbox that we have. And another area of that in regards to that, how we're doing is through our Residents 360 review. And that identifies, the information that we're passing to them. What, is it useful? And did they get what they want from us? So just to really follow that up. Karen mentioned a meeting with Sandra Crowsdale, and the fact that Sandra came to our December board and gave an update. I meet with Sandra on a very regular basis, and it's not just Sandra who obviously is making these changes within the system. So we did meet up this week prior to this to our board meeting, and we are going to get some dates in the diary. What's difficult for the system at the moment is because things aren't finalised, but we've not been forgotten, Karen. So I just wanted to reassure that to you.
Okay.
And then just to let you know with the moving on report, so the moving on service, the work was last year, and I have been waiting for a long time from someone from Adult Social Care to come back to me with dates. I have now got a meeting in the diary on Monday, so I'll make sure that an update goes out to the advisory group after that, and that's with Jane Myers, who's currently head of commissioning over at Adult Social Care. And then obviously you touched upon some issues in regards to my role within the advisory group. And I think for me, it's just to identify whoever held the advisory group would always have a bit of a because of the work that's going to come in. I will continue to hold the advisory group. I think it's about upskilling advisory group members, volunteers, and the operational team to understand the advisory group a little bit more. We've got a clear operational plan in place now that the staff are working to. So the advisory group is key and part of that. So if for whatever reason I was away from the business, the operational plan will continue to run. Therefore, the advisory group would continue to run. So it's just really to give you that reassurance. I know there's been a bit of inconsistency due to my personal issues and health. However, that's something that we are, working around sustainability as a staff team with the board, just to give you that reassurance there, Karen. Thank you.
Thank you.
All right, thanks very much. I must admit, on a personal level, I am reassured, Kate, that you actually can give those sorts of answers to Kate, Karen, because at the end of the day, I do think you need to get some confidence about what's happening for us. I think the report, it hits the right note for me. It really does bring through the key issues, the key things of concern, and the things that we as a board need to be aware of as we're going forward. What I get concerned about is what can we do to help the processes we're going forward, and certainly to help Kate and in some of the work that's going on. And I don't think this is going to be the forum that we're going to be able to come back to you on that with a response, Karen. I think we need to go away as a board to talk about that, and we've got some time's been set aside for us to go and actually do development and what we can do in terms of supporting the team and yourselves as we're going forward in the future. If you could bear with us in regard to that. But personally, I don't know how the rest of the board feel, but I think that the report hits the right note. It did actually raise a lot of concerns that we've got a lot of things that are still in limbo for you, which we do need to do more about in terms of engaging with the local decision makers around some of this. I think that's a real problem at the moment in terms of it seems to be a black hole there but finally, I feel from what Kate's saying now that there's a little bit of a window of opportunity to work through that and get into the systems better and get more influence as we're going forward, and therefore you're getting the responses that you're needing.
Yeah, and I think the opportunities that hopefully will come from I've mentioned before about the working with people and communities document that's been released from NHS England, which is sort of more robust guidance, I think, than we've had before, and Healthwatch England features in that and has been sort of picked out as important, I think. And you do wonder, I mean, I don't know how things work, but you think, well, actually, capacity and resources is always an issue, isn't it? And it's how we can get smart about it and work with the organisations and develop those ways of working and those channels for feedback, which is something Kate and I were both discussing at Pennine Care and NCA. But then you wonder, if we were part of that strategic development and party to some of those conversations, could we be providing some functions, roles that would attract funds? Because who is going to provide that independent voice when you've got so many different partners providing services? They have their own pals, but they're not independent, whereas we are independent and we can be that sort of central hub of person-centred care in Rochdale that can influence all those different spokes and organisations. So I think that's a really important factor. And I think we've said before about the local constituency meeting we used to have at Pennine Care, which was an interface between service managers, the governors who are the voice, and to be able to replicate that, I think, and provide that independence for that voice would be really valuable. But we need to be present at the conversations, at the meetings, to be able to have those conversations and be around the table. Yeah, I think that's.
And we've got to. And I think we've got as a. Oh, God, I've gone off. Everyone's gone off.
Still there, Margaret.
I don't know what's happened there.
We can hear you absolutely fine,
Margaret. Well, I think one of the things we've got to do better at, and I don't think we've got sorted out yet, is how we feed back when we're making progress. I don't know what's happening here. It's come up.
I can hear you, Margaret, still.
And we
Yeah,
can see you. Yeah.
Can you?
Yeah,
I can't see
we can
anybody.
see you and we can hear you. Yeah.
I've got all sorts on here. I don't know what I'm seeing here. Right. So, I think we've got to do better about representing things, but certainly what you're bringing to our attention through your work in the advisory group. I know that the meetings that certainly Kate and myself are going to, and certainly other members and stuff, it's really helpful stuff that we can feed in. What we need to be doing is getting the other connection all the way back through to yourselves as well. And we're not doing so well at that.
That would be really useful, because then we can know, because I feel as though we do a lot of asking and you know, we're seeking all the time as patients to be able to work with, you know, but it would be great to have that regular feedback about that progress. And we did ask for the matrix for the meetings, so that as a group we can see where we think we might be able to have some influence, where we need to influence.
Absolutely.
So
it's something the board are asking for as well. So I think there's a piece of work to be done there, I think.
Yeah. And just to confirm, the matrix isn't complete because I don't know what my local meetings are. If you think all my CCG meetings have been pulled, they were due to go in April, but actually they're only just going now because of the delay in the disperse of the CCGs on a local level. So as soon as I've got clarification on what meetings are being we're being looked at within the new governance structure, that will be shared, because there will be support requirement from a voluntary perspective to attend some of these, and training offered. Margaret, just to let you know, Ben's got his hand up, he's patiently waiting.
Sorry, Ben, couldn't you? I don't, you're not on here, I don't know why. It obviously doesn't want to see you, Ben. Sorry about that. I'm glad you're pointing it out to me. Thank you, Ben.
Thanks, Kate. Thanks, Chair. Now, just to reiterate what you said, Margaret, really good report. It's come a long way since the last board, and just to say, as a board, we do need to have those discussions about the other elements of those questions. So I'll leave it there, but fully support your comments, Chair.
Thank you very much, Ben. Anybody else?
Margaret, just a quick one. It might be view on the right hand side of your screen. And if you click on the view button, and if you put gallery, you'll see everybody then.
Right, all right, it's better. You're right. Thank you. I'm not used to it on this machine. I'll get there. Thank you very much indeed. That's helpful. Right. Thanks very much. If we can then move on to the next item. But thanks for that, Karen. It was fabulous. It really helped a lot in terms of getting good debate going.
Sorry, Margaret, can I just confirm then that we've got an action there, that Rob's got an action down there, that the board are going to go away and discuss this report and feed back into Karen within the next couple of weeks. Is that okay?
Yeah.
Thank you.
I don't know whether it might be ambitious to do it in the next couple of weeks because of
in the next month then?
Yeah, the month,
Say a month for the next advisory group meeting, because we've got a theory change workshop this month. Problem.
Yeah. Thank you very much.
Thanks, Karen.
I'm going to have to leave the meeting now. If I'm really sorry, but I will have to leave everybody. So
appreciate you. Thanks for joining us, Karen. Thanks very much.
Thank you.
So I'll hand over now to the Q1 staff update. So I don't know the order you're going to do that.
That's me. Bear with me just one second. Lovely. Hopefully you can all see that now on my screen. Let's see if I can. Bear with me. There we go. Okay. So good afternoon, everyone. I'm Rob Butler, Operations Coordinator over at Healthwatch Rochdale. I'd like to start off with a key highlight from this quarter. We embarked on a journey earlier on this year with the National Centre for Diversity to obtain the Freddie Award. Freddie, for those who are unfamiliar with this, looks at a company's embedded culture and fairness around respect, equality, diversity, inclusion and engagement. Staff and stakeholders were sent anonymous questionnaires to complete. Following the results, we obtained the award, and then we went on to be featured in the National Centre for Diversity's Top 100 Most Inclusive Workplace Index 2022. And I'm pleased to say that we came 11th, and we've got a shiny plaque now in our office that's with us for the next 2 years and hopefully longer than that. So it was just to say really well done to all the staff and stakeholders for your honest feedback. It proves that we're doing something right with the culture within the business. So on to key impact now over the last quarter.
Sorry, Rob, can I just quickly come in there?
Of course you can.
Press release on that and everything, aren't we?
We are indeed. We were just waiting until we'd done the board meeting today, and then it's going out in the public domain.
Brilliant,
We've hung on to it for a week. So key impact over the last quarter. I'll go in kind of numerical order. So number one, we reached further into the community, having recently added the option for people to sign up onto newsletters and mailing lists on our feedback form. So before that wasn't a standard item. We've seen a marked increase now as a result of this. On to number two. It was just to say thanks to the hard work for the team on the Youth Watch work stream. We've now secured the funding for the next 3 years. Item three, we've been invited by a local surgery in the borough to attend their in-house health event in September to work alongside them with the patients and residents. So that's kind of a key step forward that normally we're kind of, questioning the GP practices and taking problems and issues. They're now working with us and we're working together. So that's a great step forward. Number four, we've managed to secure a £500 grant for Volunteers Week, and we celebrated our volunteers. We took them out for lunch. I'm sure you've seen all the social media on this as well. On to number five, we recently presented over at an Alzheimer's Society meeting to raise awareness and gather insight and feedback. The response from the attendees was really positive. A lot of people weren't familiar with Health Watch. We've received some really good feedback and lived experience on this, and it's forged a future relationship now with the service provider moving forward. Number six, we are currently creating an impact page for Health Watch Rochdale's website. So any impact that we do over previous quarters will then go live onto the website, and it's in the public domain for everybody to see. So that will be an added advantage for us. You might not need to listen to me as much every month talking about impact over the quarter. Number seven, we're receiving multiple feedback about a particular GB practice. We contacted the CQC, which prompted a full audit of the surgery. We were working alongside them with updates. Pending their audit, internal processes were refreshed. And since the audit improvements, we've monitored this over at Health Watch Rochdale. We've started to receive some positive feedback about this surgery, which historically we never had. It was all negative. So the CQC intervention has obviously made a big difference in that surgery. So it's just to thank the CQC for their intervention in that one. Number eight, we've been working closely with Health Watch England over the last quarter to develop and improve the impact tracker across the Health Watch network. Myself and Claire have been on various meetings with John Turner from Health Watch England to develop that side of the business. So hopefully by the end of the summer, that will be circulated. And finally, number nine, we've been influencing with our youth watch surveys. So we've taken a number of hot topics provided to us by the youth. These have been circulated. Some of the surveys we've had in excess of 300 responses locally. The surveys not only offer support, but they also offer advice and signposting where it's required for the youth. Again, it's an area that we've never really tapped into before, so that's proving we're doing really well with it, with the amount of responses that we're having. I just thought I'd include some testimonials and quotes over the last quarter. I won't read them out, but they're on the screen. So the first one, which is the Rochdale resident one, was around menopause services. The person who contacted us was kind of at a bit of a loss. We did some research, contacted kind of local service providers, provided that information over, and that's the response that we got. And when we followed up, Rochdale resident number two, it was a person that contacted us with complex health issues and mental health issues as well. I've spoke to this person on a number of occasions now. We kind of guided them with signposting, and this is the testimonial and quote that we've received back on this one. And then finally, a quick roundup on key feedback areas. Again, we're still getting a lot of feedback on GPs, mainly around appointments, but as Kate mentioned, we're kind of focusing now with the advisory group on the GP side of the feedback and the websites. Dental still seems to be up there, but I think speaking to other health watches in the UK, it's everywhere in the UK. We're starting to receive a lot of more kind of feedback now about hospital and inpatient care, mainly negative around kind of delays as an impact of COVID. And then we've had some kind of quite complex feedback about maternity issues. When I say mixed, I mean it's both positive and negative as part of the whole experience. So from pre-birth to peri-birth. So I will now hand you over, if I've not bored you to death, over to Claire Birch, our Information and Communications Coordinator.
Hi, everybody. Rob, are you okay to rotate through the slides for me? Brilliant. So this is a quick website update. So it's from the 17th of March to the 19th of June. So we've had increases on the amount of website hits that we've had. We've had an increase, a 15% increase on how many users we have, so how many people have actually visited. They've also stayed on our website longer than what they had in the previous quarter. So the top pages that people were visiting is primarily our homepage, followed by our feedback page with 279 views, and then our events page with 210 views. So obviously we've got a lot more going on our events page now that we're back out in the community with our information, advice and signposting surgeries. So the majority of people who come to our website come through an organic search. So basically that means they will put something into Google, for example, how do I find a dentist, or I can't get a GP appointment. They're not necessarily looking for Healthwatch Rochdale, but due to our advice and information articles on our website is coming up, and so they will go onto our website for that information. That is followed by coming directly, so putting in www.healthwatchrochdale.org.uk. 21% come via our social media. So when I'm on social media, I always try to put a link to our website. 397 came from Facebook, 67 from Twitter, 34 from Instagram, and 5 from LinkedIn. And then we had 52 that are referral, which is they've come from other websites. Next slide, please, Rob. So regarding our social media update, so on Twitter, we had 44 new followers. It says we had 9 tweets, but that is wrong. We definitely had more than 9 tweets. So I think I missed a digit off there. So in the last quarter, our top tweets were a "You Said We Did." So this is to help demonstrate our impact. Meeting Josie Jenkins, who is our new Maternity Voices Vice Chair. And then a tweet with Naomi, who went to the Children and Young People's Mental Health conference in Manchester. Next slide, please. On Facebook, so all our top posts really have been primarily regarding our volunteers. So 2 of our top posts have been regarding the Youth Watch, the Youth Watch 100 survey, and our volunteers lunch, which was a lovely afternoon. So this is regarding the feedback that we've come through and how we've acquired this feedback. So the majority of the feedback we receive has been coming through our website. This has been followed by engagement events. So when we're out and about in the community, then email, then telephone, then we've had a very small amount of feedback come via social media and through meetings. Next slide, please, Rob. And this is our signposting figures. So the majority of our signpostings were to advocacy and HMRCCG, which basically reflects that the majority of people who come to us are wanting to make a complaint about services and needing assistance in doing so.
Claire, can I just ask a question there, sorry? In regards to our signposting, those figures seem a lot higher than what they normally are. Would we be able to get some figures moving forward in regards to what our previous quarter signposting were and how much we've increased by?
I can do that, yes.
Thank you. I think that'd be useful for the board to see that our signposting is massively increasing. Now we're back out on the ground. Thank you.
Yeah. That's me finished, I think, now, Rob.
Okay, so we're on to Naomi Burke, the Engagement and Volunteer Manager now.
I will try and keep it brief.
Thanks, Naomi.
Super. So yeah, so Youth Watch. So we have now been in place with Youth Watch for just over a year now. So it's really starting to make headways, and we're really starting to get some impact and doing some really good stuff with the young people across the Rochdale Borough. We have 4 young people have reached, 5 youth have just left us, but it's not because that they didn't want to be with us. It's just from other commitments and things like that. So I'm conscious that it's coming up to end of school term, that type of thing, moving on services and things. So we are 5 young people down now. We currently have 38 young people signed up to the Youth Watch 100, but as Rod said before, when we're sending our surveys out, because Claire's engaging a lot through comms as well for us, then we're getting a lot more in. We're getting, well into the hundreds coming through with, filling in the surveys that we're sending out. We have had 4 of our young people who have now attended 5 or more meetings. So we have rewarded them young people with a certificate, a lovely letter, and a voucher of their choice for £25 each, just to reward them and recognise the work that they've done. The picture at the bottom there, that's Elizabeth. That's one of our members who's been with us right since the beginning, since last March. So she's been with us a long time. We've been doing some community partnership with Vibe, who are up on Drake Street. They're helping us create an animated video with a group of young people who they work with around healthcare access within the borough. And also as part of Volunteers Week, we celebrated the Power of Youth Day. We sent a thank you email and like an attachment to all our youth voice people who join us. Our monthly meetings are still going on and they've been very, very positive, and we've got ongoing recruitment going on. Next slide, please, Rob. So one of the wonderful things that we have done is we've been engaged with Be Well conversations. So the actual aim of the Be Well was to gather youth insight into how they experience life growing up in Greater Manchester. So they looked at before the COVID pandemic, during the pandemic, and after the pandemic. So they did a lot of work across Greater Manchester. Fairlinge Park were involved with a lot of the workshops they did. But moving on from that, they wanted a wider range of youths to get involved with these conversations. Next slide, please, Rob. And when they did these conversations, we actually did 2 online focus groups, and we did a face-to-face group, the previous picture of the young people from Brown Hill who we engaged with. And we got a mixture of conversations back in from the youth. The key questions that Be Well wanted to know about was emotions and relationships, drivers of well-being, understanding the self, school, environment and society, and their future aspirations. So we are in the process of collating all these answers that the youth gave us and sending them over to the Be Well to empower their conversations. We did get a grant for this from Be Well as well. We was one of only a few who were successful in a bid for the grant, and the youth who took part in either the online focus groups or the face-to-face one was rewarded with a £10 incentive gift card and a certificate as well for their participation in that. But it opened up some really good conversations, and we had I think it was 13 representatives in total across the 3 different groups who gave information to us. But as you can see from these comments, it's a mixed bag of responses, what they were giving us, but very interesting as well. So next slide, please, Rob. So involvement and engagement, we have been all over the place at the moment, but we've got 3 main projects that we've been doing. One of them is a collaboration with Cartwheel Arts. That's a picture at the bottom of us over at Deeplish. We've worked with 6 South Asian heritage mums with their children, looking at maternal inequalities, looking at their maternity journeys, and looking for gaps in services, etc. With Youth Watch as well, we did some more work over at Brown Hill Pro Unit, looking at, they did a digital project and they safely searched the internet to find local services that were of interest over 4 key topics. And we're going to be making that into a leaflet to share for over the summer holidays. And we finalised the Engage project, which is a commission piece that we did with Radag. The report will be out soon, and also as part of the Youth Watch, the youth work that we did, what with Vibe, they will be sharing a video that they've done as well, what we've commissioned them to do. So it's been really exciting doing these 3, and it's just been really nice because they're all 3 very different topics and areas of engagement. Next slide, please, Rob. And out and about, we have been absolutely everywhere and anywhere. I have never been as busy in my life as I have this quarter. We have been on everything and everywhere. It's been really, really good. And we're getting some really good feedback coming in now. It's opening up them pathways a bit more, raising more awareness of us. We went to, as Claire had said in comms, I was invited to the Children and Young People Mental Health Conference in Manchester. It was really, really insightful and really good for networking and looking at how other organisations and things what we youth in across Greater Manchester. We've had the Volunteer Social Medicine Tap. We've done added an awareness raising session as part of hashtag Wednesday Weekly with Action Together, which was live streamed, and then it is available on our YouTube channel for everybody to have a look as well. It's a really good introduction to what we do. We're still on lots and lots of online forums, and we're getting back out in person now, back at other forums and networking events across the borough. So we have been really, really busy, and again, taking part in all the information, advice and signposting, which are going really well. This morning alone, I've given out over 40 leaflets at Nye Bevan House and gathered in nearly, I think it's 15 pieces of feedback in just a 2-hour slot. So it's been really, really good that we can get back out there. Next slide, please, Rob. This has been the highlight of my month as well. We've been part of the Rochdale in Rainbows. We've been doing all sorts of different engagement events. We've been at the flag raising. We've been at the Rochdale in Rainbows Pride in the Park event, which was absolutely fantastic. I gave out over 100 leaflets. I was well chuffed because I've never given out that many leaflets in my life. So it was really, really good. And it was really good to see so many people come to it as well. We also attended the Nitty Gritty, Knitting the Pride flag at Touchstones. So it's still Rochdale in Rainbows at the moment. There's lots of things going on, but we have had a key part in a lot of gathering feedback from these different events that's been going on. So it's been really, really good. Next slide, please, Rob. All the way back to Easter, which seemed like ages ago. We had an online quick catch up with some of our volunteers, and we did an Easter quiz. Elizabeth, one of our volunteers, got the most answers when she returned it, so she won an Easter egg. And I've also met across most of our advisory group volunteers and others face to face and on one-to-one, just to have a catch up as well, which has been really, really nice. Next slide, please, Rob. And this was our thank you event. This is Elizabeth, absolutely enjoying the ice creams while we're out. I love meeting our volunteers face to face. I'm so appreciative of all the things that you all do for us. You know, you are the heart of our health watches, you know, so it's been really good. We did, as Rob said before, we got a grant towards this, and we will be doing something with our youth watch at Put Stars in August as well, just to recognise and thank them for the work that they do with us. And I think that might be it. Is that it, Rob? Have I got one more? That's me done. Thank you.
Thanks, Rob. Can you go on to the next slide for me? So I'm going to keep it short and sweet, and I apologise because my puppy's going mad in the background. So from a strategic perspective, the work that I've been working on for the first quarter of this financial year is the Health Watch England Quality Framework, and liaising with John Turner, who's the North Development Lead, and ensuring that we've got our processes and action plan in place to improve things here. We've got, I've been working on the advisory group development and looking at the documentation review and decision-making policy, and ensuring that's in layman's terms and that the system can understand that. And we've got a session next week with John Turner and our advisory group looking at theory of change planning. So a theory of change is a way of planning a piece of work, and it's looking at more of a hypothesis approach. So that's something that we're going to embed within the advisory group, and the first session on that piece of work will be next week. So I've been attending a lot of stakeholder meetings, getting my face back out in the borough. Now we're more face-to-face, and that's been really positive, increasing workloads, as it always does, but really positive approach. It's great to be back out on the ground. Scrutiny meetings have been attended, and we're just ensuring that, you know, our faces back around the table on a face-to-face perspective, and ensuring that, you know, the voice and the concerns that we've got from a public perspective are raised. A board development session's been run this quarter, which I wasn't directly involved in. However, I just like to highlight from that strategic perspective, there's a lot of work going on there around the board development, the advisory group development, the operational staff development. It's a key time for us to be bringing to finding all the connectivity between these different groups. Work on the business continuity plan and ensuring that, you know, if anything within the operational team organisation is going wrong, we've got a continuity plan in place to ensure that we continue to fulfil our statutory duties. And then a key thing for us this first quarter has been that looking at the future strategy and that horizon scanning and seeing what's around the corner for us. With our tender coming up, it's something that we really need to think about what's next rather than living in the here and now. And then from an operational perspective, I have been out on the ground supporting Naomi at the Middleton engagement work. So I'm back out on the ground, and it really is great to, you know, have people coming up to us and talking to us again. So the GP website review is something that I've been leading on, and we did the audits last year on all of the GP websites. And last night we completed a focus group with 9 people attending, and they all received a £25 incentive and we've got some really good feedback around what a fantasy website would look like to people out in the borough. Staff development sessions and staff annual appraisals are currently in full flow, and we're looking at, you know, what support the staff need, and with those annual appraisals, what's next around the corner for them as the contract develops. I've completed the safeguarding annual audit and got the return to do there in regards to additional information, and that's something that we have to do every year. We normally do the full, I think it's a section 11 audit. However, they have lowered it down for us this year, and we've just had to do like a lower level commissioning one, but it's still making sure that as an organisation we are covered under the safeguarding requirements. I'm currently in the middle of an operational review, and that's looking at the staff role specs. There's been a few changes operationally from April in regards to staff roles. So we are going to be reviewing the whole of the staff operational roles to make sure that there's no gaps in regards to the large work that we do cover. Already touched upon, but we've got the quality kite mark, which has been a great piece of work that Rob's led on. Myself and Naomi have been working on training and volunteer planning for the year to really identify how we move forward, re-establishing our volunteers back out on the ground and looking at what training they're going to need with the changes to the health and social care system, especially in supporting them with that and thinking about our enter and view and the observe and acts that we're looking at doing at the hospital. So really busy time for us all. As you can see from the staff update as a whole, we've been doing some really great work. It's great to be back out on the ground, and you can see that we are back out on the ground by the data and the information that's coming back to us as a whole. So if the board have got any questions, happy to take them from myself or the staff members.
Any questions? As usual, excellent reports in terms of what's happening and what's going on. Really impressed. Any other questions or comments?
No, I concur with that, Margaret. Very good reports, some excellent outputs. Yeah, great. All right, I'm conscious of the time, and my phone's ringing in the background, so just ignore me. My sister's trying to contact me. I think she's done a few phone calls now. So if we could move off to the next item, if that's everyone okay. Thanks very much indeed, everybody, for that. 10 is the engagement plan, and we need a decision on that today. Do we need to be pulling that up?
Yeah, I'll share it on my screen. So more than anything, it was for information rather than approval on it. Right. Yeah, so it was more for the board to just see the fact and us to share it in the public domain that this is the engagement plan that has been created, and it's been dropped into the finer detail of an operations plan. It's similar to the comms plan, which Claire has created, which has already been to board previously. So I'm happy to share it. Just bear with me 1 minute. So just let me take it to the top, sorry. So it's an internal engagement plan. But like I said, for transparency and openness, I just wanted to share this document with the board and with anyone that's watching the public meeting. So it's looking at our engagement target audience, so really pulling out our key stakeholders and where we need to be making sure that we are hitting. Yeah. So we've got objectives in regards to our statutory functions, so to provide local care information, and then it states what the method is behind that, our expected targets, so our KPIs, which are reported away from the public domain. However, they've been dropped into this, the ownership and any sort of like risk assessment that's been there. So it really does identify, and it's just a bit more of a detailed plan to give, like I said, the board and Joe Public, and this will be added to our website, an idea of how we're going to engage and what the plan is for the next 12 months in line with our KPI documents and our statutory requirements. So it was just really for information and to say I'd take any questions on it or anything anyone might have to say on it.
Yeah, I just appreciated seeing this in that way, well presented. Thanks very much indeed. Any other comments from any other board members?
I think just go on. No, sorry, I was just going to say, I think one thing that I did want to just to highlight really was the external forums that we attend on the back of that. I mean, I've mentioned some of the meetings that we pick up under my presentation at the beginning of the board. These are some of the forums that Naomi attends, and this is Naomi's piece of work, so I can't take credit for it. Amazing piece of work by Naomi. But you can see there's a lot of engagement that we are doing in regards to meetings. These are more voluntary sector based than they are in regards to sort of like the strategic. Mm-hmm. But you can see from a staff capacity perspective, there's a lot of requirements here. So just really to highlight that, and just for the board to take note of the information that's in there.
Thank you very much. Everyone okay with that? Thank you. That's great. I appreciate seeing it anyway. So if we go on to the next one, I presume it's got down the annual report pre-approval, but we've done this virtually now, haven't we?
Yeah, so it's come to the board just for good practice and to highlight it in the public domain. The annual report has been released today. It's been sent over to Healthwatch England and it's gone over to our stakeholders. Sorry, the board have pre-approved this prior to board because I needed it to be out live today. But I just wanted it to be highlighted at the board that it's been approved and how amazing report it is. And thank you very much for the team for pulling this together again, and Claire for leading on this piece of work. It really does highlight the good work that we've done over the next 12 months. I think moving forward, what's really key throughout our presentation today is really pulling out looking at the next 12 months, the impact and the outcomes that we are doing, and because they are there, it's just really making sure that we're identifying them at the right points, and our reporting and recommendation writing will be key on our agenda for this year.
Yeah, absolutely.
Thanks,
Any
Margaret.
other comments? Thanks. Again, very good report. It showed the breadth of what's going on, which is brilliant. Thanks very much. Any other business?
Sorry, can I just have a quick thing about that? I did send one comment in about I haven't seen it since made that comment, but having the directors, should we have listed the directors in that report?
They were added.
They were added.
They were, sorry, right.
Yeah.
Thank you. I must have missed that. Thank you very much.
Thanks, Ben.
Thank you. So we started late, but we've caught back up and we're back on time again, I think. Thanks very much. Is everybody okay we close the meeting now and have 5 minutes break if you come back?
Yeah.
For the
great.
part 2 meeting. Thanks very much.
Thank you.
Thank you,
Thanks,
everyone.
Take care, everyone.
Thank you.
Goodbye.
Thank you.
Bye.
Bye.
Bye.